Without being a nurse or a doctor, you can make a diagnosis of stroke if somebody beside you is having a stroke by just being observant. This is not difficult if you use the acronym FAST, F-A-S-T. Before we talk about the acronym, what is stroke? Stroke is also known as brain attack. It is a medical emergency, and it means that there is brain damage as a result of interruption to the blood supply of the brain. So it can be as a result of blockage, which is called ischemia, or as a result of bleeding into the brain, hemorrhage. So when a vessel ruptures and blood floods the brain, that is hemorrhage. Either way, that person is having a stroke. When they have stroke, it results in brain damage, and sometimes it is irreversible depending on whether they get help at the right time or not. Let's go back to our acronym FAST. F-A-S-T. FAST. In this acronym, F stands for face. So if a person is having stroke, their face droops. They have weakness of one side of the face. And so if you ask them to smile, that smile is distorted. That face is distorted. And there is asymmetry. You will see that the strong part of the face will pull the weak side. And so you will see that they are not able to close their eyes on the affected side if you ask them to, or if you ask them to smile, you will see that the mouth is deviated to one side. If you have seen the sign, then move to the next letter of the acronym, which is A. A stands for arm. Yes, arm. So you ask that person to raise both arms. They should be able to raise both arms to equal height. But if they are not able, sometimes they may not be able to move that affected hand at all. Or sometimes they may be able to move it, but not as high as the other one. So you have something like this. They move this very well, but they are not able to move the other one very well. They might be having a stroke. And check the leg on that same side. It might also be weak, and they might feel numb on that side that is affected. The next letter is S. So ask them to talk or engage them. At least we ask them questions. When you ask them questions, they may respond with a slurred speech. If you know them well, you might be able to pick that something is amiss. That is not how they talk. Or it is very obviously slurred, or they may not be able to talk at all. Sometimes they may not even be able to understand what you are saying. Yes. So if they cannot comprehend your own speech, or they cannot talk, then their speech is affected, and you can know having stroke. The last letter is T, and it stands for time. It is not a sign, but it is telling you what to do. Time is of the essence here. That person must be taken to the hospital immediately, and that is because brain damage can become irreversible unless that person is taken to the hospital immediately. In fact, the condition may be fatal, especially if that person has hemorrhagic stroke, the one where there is rupture of a vessel and there's bleeding into the brain. So it is important to take that person to the hospital immediately within 3 hours of onset of symptoms. And you know that sometimes that symptom has started before you even notice. That is why you should take them to the hospital immediately so that this condition, if possible, can still be reversed. I hope this helped, and I hope that we will share it with everybody so that together we can save brain. Yes, time is brain, time is neuron. Together, let's save brain. Together, let's save lives. So please share with everybody so that we can all know it, familiarize ourselves with the signs, and we can pick it just in case it is happening to somebody close to us. And please remember, good health is great wealth. Don't take it for granted. This is our topic for today. I'm Dr. Abosede Adegbite of Clinic Annex. I'll see you again next week, God willing. Until then, please be safe out there. Bye.